We're glad you're here this morning for part 2 of this important event. The American Academy of Pediatrics defines adverse childhood experiences and trauma as the public health issue of our time. This statement predated the COVID-19 pandemic, which we still find ourselves battling, which it's enduring stress on our children and families, making this response as urgent as ever. You may have joined colleagues from around the state last May when Justice Barbara Periante led some of Florida's most influential leaders in discussion about the ongoing epidemic of ACEs and trauma, what action they are taking, and how we can all help. Today's panelists are knowledgeable leaders of the highest levels of education, early childhood mental health, and pediatric medicine. And we are excited to take a closer look with them at the best practices in these critical areas. All of us on this forum today know adult violence, domestic and child abuse, addiction, chronic disease, depression, and anxiety, and other lingering issues have their roots in earlyhood childhood trauma and ACEs. I champion this work as someone who understands this impact from personal experience. I survived toxic stress. But if not for the outside support I received in my youth, the chances for me having a healthy and stable life would have been deeply diminished. I am a true living example of how impact of ACEs can be stopped dead when someone is willing to fight for you. To prove that point, Renee Lehman actually tracked down my high school drama teacher so we could share a little bit of my story with you.
I didn't know what was going on in Eddie's life at the time.
Hi, my name is Eddie Stevens. I'm an equity partner here at Ward Damon.
After many years and reconnecting on Facebook, that I learned about all of his struggles and all that he had been through.
My mother died when I was young, and I was very fortunate to have some great people around me. Specifically, I remember my drama teacher.
I'm Julie Peterson. I'm Eddie Stevens' drama teacher at Gulliver Preparatory High School in Miami. Eddie was sort of a shy, quiet little guy.
In my time of pain, I actually wanted to be a theater geek, and I wrote a play.
One day Eddie walked into my office and he had a script that he had written, and he wanted to have the script produced in our season. And it showed such insight into character and human emotion. And he did a fantastic job with that play and toured it throughout the city.
It was about someone who lost their parent. And had she not believed in me and given me that opportunity, I don't think I would have been someone who believes in himself.
I just saw a young man with many gifts and talents, and I realized that they needed to be nurtured.
Today, I am sitting here as the owner of a law firm where things could have been quite differently, but for one random individual being in my life. The good news is the ACEs war can be won. To succeed, we must build trauma-informed communities where all adults play a role in the lives of children, are ACEs aware, surrounding them with support, love, and protection. We know how to build trauma-informed communities. This is why you are here today. As leaders of the systems that provide guidance, education, and healthcare to our children, we must each do our part to prioritize their needs at the center of this fight. Before we join our esteemed panelists to take a close look at what they are doing to make significant progress in the war of ACEs, we want to share some video highlighting models for building trauma-informed communities. The first video is created by our host, Center for Child Counseling, and it introduces a way of being with children. a manual offering practical, insightful information, strategies, and activities for teachers, parents, and adult caregivers of children. It focuses on attitude, knowledge, and skills to foster positive caregiver-child relationships.
A West Palm Beach organization has developed a new course to help child care providers better address trauma.
WPTV News Channel 5's Sabira Rayford spoke with the executive director of Opportunity Early Childhood Education and Family Center about why they say this new program is so needed.
The West Palm Beach nonprofit serves families who wouldn't have access to stable child care. They say currently their wait list is at 400 children, and many of those children come from difficult backgrounds and have faced trauma. Now they're hoping a new program will help. Allie Eager knows the importance of playtime.
It's amazing when they're happy and allowed to play and grow and be free.
She's the executive director here at Opportunity Early Childhood Education and Family Center.
This is the best day ever!
Provide quality care for young children of low-income working families.
The goal is to help them slide into success.
Be the generation that breaks the cycle of poverty in their family.
Allie says mental health and coping skills play a large role in their efforts.
We do have quite a number of children at any given point in time that have or are currently experiencing trauma.
The Center for Child Counseling is launching a new online training and public health campaign to help.
It affects children even more so than adults. And especially if you don't have anyone who's there for you, we call it the buffer, to help them build the resilience.
Dominica Nolan says the 5-hour course helps adults identify trauma and address any problems they may encounter.
Children don't have that vocabulary to communicate and express themselves to adults. That's why they do it by sometimes acting out. Need someone to be there for them.
It's something that will affect all of us, and everybody really needs to be aware and be a part of the awareness and the solution.
Reporting in West Palm Beach, Sabira Rayford, WPTV News Channel 5.
Our next video comes from the Center for Prevention of Early Intervention Policy of Florida State University, offering proof that early childhood court system is saving families thanks to a supportive network of partners and leaders like you.
It was 2018, yes, is when it happened, October 2018.
2018 DP 127, in the interest of Marley and Charlie Jones for status of early childhood court.
They had to mention, I think, one time about the kids being placed somewhere permanently, and I was like, oh, that's not going to happen. I'm not going to let that happen. I couldn't let them down. Intensive outpatient treatment I did twice a week for 4 hours. I just pretty much had to learn how to get my independence, and I got sober.
Tell me how things are going.
I'm engaging in all my IOPs, passing my UAs, staying sober.
We are recommending overnight visitation.
Nice work.
Thank you.
You did this.
The early childhood court, I have to say that it's a very good program. It helped me get to where I am now. The whole team was awesome, working with them, from the caseworker to the judge. He watched me grow, and he watched me become what I needed to be to do it for my babies.
It's been a privilege serving you. I can't wait to hear about the next good thing that happens in your life. What's your new job?
I'm a receptionist at Trident Marine.
That's fantastic.
He told me I should be I'm a poster mom inspiration, I believe, to childhood court is what he told me. They don't want you to lose your kids. They don't want to rip families apart. You know, they really try to put them back together. People don't see that.
We have seen so many healed relationships. It's really the judicial leadership, the community coordinator, and the child parent psychotherapy.
Many parents don't have that understanding of being held.
That's okay. We will work with that and move forward from that. She tried her hardest and fought through the whole thing and never gave up.
Anybody can do it, you just gotta really want it, especially for the babies. You have to do it for the babies. You have to.
She continues to just thrive, and she's just a different person than she used to be, and it's awesome.
We do want to congratulate the mother. She has done so well and really stepped up to the plate.
I was honest with them about everything, from using to relapse. Just be honest and they will help. And they help me every step of the way. I have my own place. They help me get that. And I have a full-time job. Honestly, they are my life. They're my everything.
Everybody can change. I think you have to believe that people are capable of change.
Thank you for sharing this work with us. A Way of Being with Children guidebook and corresponding training are available to all of us today from the Center of Child Counseling. We don't need reminders today of how critical a time we are facing. When we met in May, we expected to emerge from the pandemic and begin addressing the long-term fallout of COVID-19 on child and teen health. Instead, yesterday, Palm Beach County declared a state of emergency, and our families and communities are more confused, anxious, and disheartened as our daily lives and our health remain uncertain and under threat. Today's panelists are first responders to childhood trauma and crisis in their professional roles, attacking the issue of ACEs with passion and persistence. Each has acted to bring change within their area of expertise and are asking each of you to do the same within your circles of influence. Collaborate, coordinate, and advocate. It is my pleasure to introduce our esteemed award-winning and action-driven panelists. Mr. Ed Tierney is the Deputy Superintendent, Chief of Schools for the School District of Palm Beach County. Ed's 18 years with the district includes the roles of Chief of Staff, Instructional Superintendent, and Principal. His expertise lies in exceptional students, behavior intervention, and raising student graduation rates in high poverty schools. Dr. Mimi Graham is Director of FSU's Center for Prevention and Early Intervention Policy, co-founder of the Florida Association for Infant Mental Health, and spearhead of Florida's Early Childhood Court Initiative, integrating mental health into courts to break the multi-generational cycle of ACEs. Dr. Shannon Fox-Levine is a pediatrician and president of the Palm Beach Pediatrics with a special interest in behavioral health and working towards integration of mental health into primary care. Amber Payne is president of the AP Community Partners Consulting and heads strategic initiatives at Center for Child Counseling, including research and publishing of a public health approach to fighting ACEs in Palm Beach County, the catalyst for the Lead the Fight and its continued effort to inform and mobilize. Welcome, everyone, and thank you for being here today. Let's dig in. Each of the following questions will be directed to a panelist, but we ask the rest of you to join in with any further thoughts after they respond, and we will do our best to try to address those. Our first panelist we're going to chat with is Mr. Ed Tierney. How are you doing today, Ed? And thank you for joining us.
I'm well, thank you, and so glad to be here.
We are still trying to emerge from a pandemic with increased levels of anxiety and depression in our young children and in teenagers. In light of ongoing concerns, what is the school district's vision for meeting the mental health needs of our children?
Yeah, thank you for that question. Our board, superintendent, and senior leadership have placed a lot of emphasis on maintaining healthy student mental health over the last couple of years. We've kind of bolstered our staff in order to do that with certified school counselors, English as a second language, bilingual counselors, psychologists, family counselors, mental health professionals, social workers. And we recently created a position called school behavioral mental health position that is in every school. So we've focused on this effort. Thanks to the generosity of the taxpayers, we've been able to fund a lot of positions. But we're really cognizant right now, you mentioned the COVID and the lockdown, of the fact that we don't know the ramifications of locking schools up for a year, making students learn remotely, wearing masks. So I hate to say our strategy is to realize we don't know the outcome, but there is no historical perspective on what we should expect on how this will affect kids. So we think we have the infrastructure, we think we have the leaders in the schools, but we're really cognizant of the fact that we don't know what the ramifications will be, how this will play out. So we're trying to be nimble as we see, the effects now and in the future affecting our students to be able to react appropriately.
And from your perspective, other than the unknowns we just talked about, what do you believe the greatest remaining barriers to improving mental health resources in our schools are?
I think, we mentioned in the video, it was the building the trauma-informed communities. I think there's still a stigma attached. We still don't put the resources there that we do other places. So, if one of us breaks an arm, what do? You go to the emergency room, you get it fixed. There's no embarrassment, there's no question, there's no stigma with that. And I think we really need to continue to work towards getting mental health issues, emotional issues, when you just need help, but it's not necessarily physical. We need to get that to the same level as when we have a physical ailment, to just go seek the help needed.
Hopefully this discussion advances that.
I hope so.
The district partners with CFCC, Center for Child Counseling, to integrate mental health therapists and programs in schools using trauma-informed models of prevention and intervention. We see a great example of a model that is really attuned to the needs of the community children at Northmore Elementary School. Could you please describe that program for us and tell us why you think it's so effective?
It is a model, really an incredible school, and I'm glad to have the opportunity to speak about it a little bit. It starts with school leadership, and the principal at the time, and her AP now has taken over, so that leadership should continue, just place tremendous effort on culture and relationships and creating an environment where students succeed academically, emotionally, physically. So it was really her vision to bring in the whole network of support that created such a wonderful place as Northmore Elementary. So a lot of their theme is partnerships, right? They'll partner adults in order to support students. So a behavior intervention associate, which intervenes when a student has a behavior that needs to be addressed, is partnered with a counselor because they recognize that oftentimes that behavior is driven by, some emotional issue or some mental health issue. So that partnership is designed to support the student and not just, kind of highlight the behavior. They have groups for students who've lost parents, groups for students who are experiencing poverty, groups for students who come from single parent homes and struggle with that. So the theme you really see at Northmore, relationships, really caring adults, and and adults partnering in order to support the students that they serve.
And if this model is working so well at Northmore, is it possible to create a model like this at every school?
Yeah. Is it possible? Yeah. So, but replicating greatness is difficult, or else everything would be great, right? So the possibility exists. The challenge is to find the right leaders to go in and set the tone in the schools in order to create that type of environment. So, when we interview principals for any school, 2/3 of the interview questions really come down to the subject we're talking to. I always say I want to talk about academic systems, culture, and instruction. Instruction is the teaching, but the culture is really relationships that the potential principal envisions creating at the school. And the systems are, how do you determine when a student is struggling? What do you do when that happens? So it's not random, or if you happen to be in a good teacher's classroom, it gets taken care of. And if you happen to be in a teacher's classroom who is not as attuned, it doesn't take care of. So we're trying to replicate that model through hiring, through modeling, Northmore certainly an example, and through spreading best practices throughout the district.
Social emotional learning is a strong model used well in our classrooms, but teachers, they're not mental health therapists. Teachers need to recognize and address deeper traumas when they see their students. How important is trauma-informed training in today's classrooms?
It's really incredibly important. I tell people that I think students need us to be what they need us to be, right? Sometimes they need us to listen. Sometimes they need to set a boundary. Sometimes they need us to line them up with someone who can help. So we really need to recognize what they need, oftentimes when they are not even able to articulate it. So that the trauma-informed care that you're addressing really kind of speaks to our ability to recognize when a student has a need, even if that student doesn't recognize it, and then diagnose the best person to help. Recognizing teachers are not mental health experts, but they are relationship experts. They are kid experts, and they can use that expertise to get the student to the person who is best positioned to help.
Ed, thank you for your comments, and don't go too far, because I think we'll be back to you.
Absolutely.
And for all of folks observing this lovely conversation, we want you to be a part of this conversation. So if you have any questions, drop them in the chat box, and we'll do our best to address them for you. Next panelist up, Dr. Mimi Graham. How are you, Mimi?
I'm great, thank you.
So how is the last decade of knowledge around brain science and early development changing how we approach children's mental health?
Well, I'm thrilled with how we've infused infant mental health and early childhood mental health into the schools and childcare and our child welfare. We've seen expulsions go down from schools and Baker Acts as well in those communities like Palm Beach that have early childhood mental health consultants to the schools. And we're thrilled with and wish every school system and community would have those. We've also seen really major transformations in child welfare because we're bringing our clinicians to one of the most traumatized populations we have, and that is our folks in child welfare. Most of the parents in child welfare were abused or neglected or grew up in the system themselves. And so they come with their trauma and they try to buffer that trauma either through numbing it through addictions or through other modes that aren't very helpful. So when we bring the therapist into early childhood court, we treat the family, the parents on their trauma and the children on their trauma and promote a healing relationship. And as a result, what we're finding is that the families get out of the system sometimes 8 months faster than other kids in the dependency system. But more importantly, when you heal the underlying trauma, the families don't come back in. They don't need to do the drugs. They aren't depressed anymore. Their mental health issues are healed because we finally address the underlying root cause, which is trauma. So like you just saw in the video, we have so many success stories of parents who finally we have addressed their trauma, and it releases their capacity to be really good parents. So we're really thrilled with some of the movement in Florida.
What a beautiful way to end that generational cycle.
Absolutely.
So ACEs, the science has been out for about 20 years. We know what needs to be done. How is the ACEs science being put into action in our state right now?
Well, I'd like to give two examples. One is the Department of Juvenile Justice. We've had some incredible secretaries over the year. Wansley Walters started it several years ago and actually had legislation that calls for a trauma-informed DJJ system. And they did their own ACEs study of DJJ kids, about 65,000 kids. Well, guess what? Guess how many of those kids had one or more ACEs?
All of them?
97%. And wow. What was more alarming is that 50% had 4 or more. We work with pregnant girls involved in the court system. Many of them have been trafficked. All of them have been sexually abused. And so understanding their trauma has really changed the way that some district attorneys are offering trauma treatment instead of the usual sanctions for some crimes and offenses. And we know that healing their trauma is a lot better investment than locking them up for our future and for theirs. And then secondly, we've seen health departments and pediatric clinics across the state beginning to use ACEs questionnaires to identify trauma and connect kids to treatment. Our FSU Center for Stress and Health at the College of Medicine has a kiosk in their waiting room so families can fill out the ACEs questionnaire, and then they have psychologists right there on staff that can support them. And in addition, many communities like Palm Beach and Tarpon Springs and Sarasota and Gainesville and Orlando, they've really embraced trauma and ACEs at a local community level and are doing awesome things across all the systems to really fight ACEs like you're doing in Palm Beach.
Well, COVID-19, it's been crazy. It's been difficult for children, families, teachers, everybody. Can you speak to the efforts that we're putting in place to build resiliency in our children?
Absolutely. There have been several really innovative resiliency solutions. I'll speak one from FSU. A couple of years ago, it was graduation, and there were 3 attempted suicides during graduation while the parents were sitting there in the auditorium. And President Thrasher insisted that we increase our efforts to support mental health of our students before graduation. And exams and school can be very stressful. And so they created a campus-wide initiative called the Student Resilience Project. And now it's required for all new students coming on campus to reduce the stress, improve their mental health. And they have interactive videos, they have ambassadors, and they're promoting social connections, which we know is the biggest factor in promoting resilience. We also have a lot of colleagues across our state. Some of my colleagues at University of Miami are looking and geo-mapping the areas to try to figure out, well, why does Little Haiti have better outcomes than Liberty City when you have the same risk factor? What are the resiliency factors that those communities are embracing that are changing the outcomes by neighborhood? And then my colleagues at UF are geo-mapping where we have abused kids and where we have high quality childcare. And with the intention is that quality childcare is a protective factor and a resiliency factor. So our goal is that we could connect these high need kids with high quality early care and education that could increase their resiliency. So we're really encouraged that we have some legislative support. Our incoming, our Senate president grew up in the child welfare system. I think he was adopted. So he has made it his priority to really bring the trauma education and resiliency into the legislature and to do things like fund our early childhood court statewide. So we're also thrilled that the national level, there is legislation to do baby courts across the country. There's legislation for trauma and resiliency. So one of the best things that's happened out of our COVID, pandemic is that there is a lot of talk about both trauma and resiliency and ways that we can heal. So a silver lining of the pandemic.
Dr. Graham, you just mentioned bringing this court statewide. One of our audience members, an esteemed family lawyer, Robin Scheer, notes all courts should be this way. So do you have any thoughts on what we need to do to make that happen?
Yes. Amen, Robin. Yes, we would like all of our courts to be trauma informed. And what we're finding is that when judges are trained in trauma, many of them have dockets besides dependency. So what we're seeing is that they're bringing, you can't unsee. Once you've seen with a trauma lens, you see all the courts and families in that way. There is some legislation to require and encourage trauma education for all of the judges. You said earlier you had trained some lawyers. We do a lot of training with lawyers, judges. We would love to get it in the law schools. And so people come out with a trauma lens. This national legislation is offering baby courts nationally. There's $25 million proposed to start. There's about 100 baby courts across the country. And although we have 27 baby courts, early childhood courts in Florida, we're only serving less than 5% of the eligible kids. So my goal is that we serve at least all of the kids 0 to 5, which is the biggest group coming into child welfare in this trauma early childhood court program. So that's our goal, and we hope to make it happen.
Thank you so much, Dr. Graham. Now I'm going to turn our attention to Dr. Fox-Levine. How are you today, Shannon? You there?
I'm good. Thank you, Eddie.
Welcome, and thank you for joining us today. You're on the front lines. You're practicing pediatric. What signs do you notice in your years of practice that convinced you of a need to address mental health in that pediatric setting?
Yes. So, as you mentioned, I am a pediatrician here in Palm Beach County. We have 3 offices in central Palm Beach County. We employ 12 providers. One of them is a psychologist. One of them is a psychiatric nurse practitioner. And this has developed over my 20-year career here because I've dedicated my career to really trying to integrate different types of strategies for mental health with primary care, mind and body. I completed my residency in New York at NYU Bellevue Hospital, and I know many people know just the reputation of Bellevue as being a psychiatric hospital. And I have to say it was a phenomenal experience to train there. And I developed a great interest for behavior and development there. So I learned as much as I could. And it just so happened that my first job out of residency was in Quincy, Florida, outside of Tallahassee. I was hired by Tallahassee Memorial Hospital to take over a 30-year pediatric practice that the beloved Dr. Pat Woodward was retiring from. And Dr. Woodward, on my first day, looked at me and said, "Have you managed much ADHD?" And I was so grateful that day for my training because I had, but I figured that maybe that wasn't commonplace in the training of pediatric residents. So it wasn't about how much practice I had with asthma or diabetes, it was mental health. Gadsden County at the time had one of the highest poverty rates, might have been the poorest county in the state, maybe still is. So many of my patients had behavioral issues, whether they were genetic, fetal alcohol syndrome was, there was a high rate of there, or environmental from ACEs in origin. I struggled, even though I had some education and training, to support them. I felt forced to prescribe medications because of the lack of resources. I was all they had to hopefully find the right pharmaceutical to keep them in their seat, to learn, stay out of trouble, and live through the ACEs that they experienced on a daily basis. So I learned very quickly that Quincy, Florida was not New York City, even Tallahassee was not New York City. But I honestly didn't feel too in over my head because I did have that training. What I noticed, though, the very early years of my career there, was that this education and training that I had, I could actually make a difference with, but many of my primary care colleagues did not. So my experience should not be unique anymore. We really should be educating our medical students and residents in any primary care, and even, trauma informed across the board in medical school. It doesn't matter what field you go into in medicine. My feeling is everyone should be trauma informed. In residency, we have a saying, see one, do one, teach one. And that's our approach to learning. So I am now ready to make a commitment to being more involved with the local primary care training programs to teach how to integrate mental health into the primary care setting. I have seen it, I have done it, and now I'd like to teach it. I've been the foot soldier in the mental health battle in the first half of my career, but now I'm ready to lead the fight.
Well, what you're doing is remarkable, and we wish every pediatric doctor screened for ACEs and employed mental health in their practice. But realistically, you're going to face some challenges, and you have to connect parents to supportive family services like prevention and early mental health care. What do those challenges look like?
Yes, and that's definitely, our struggle. It takes a village. We are community partners as pediatricians. We are the medical home. So the medical home concept is even formulated by the American Academy of Pediatrics to address chronic health problems. And it's even defined as care that is accessible, continuous, comprehensive, family-centered, coordinated, compassionate, and culturally effective for all children. So this medical home concept is the ideal approach to care for these children with many complex needs. The key for us as pediatricians, though, to overcoming the challenges of connecting the parents to the services is to first identify them. We need to know who they are that need these services, and then to be able to refer to early intervention. If we're not looking for it, we're not going to know it's there. So as pediatricians, we practice and are the experts in preventative medicine. We give vaccines to prevent illness, like right now with COVID-19, which please, if you have not gotten your vaccine, this is a little plug for the vaccine. Please get your vaccine. If you're 12 and older, get your vaccine. So many pediatricians, though, were comfortable talking about vaccines. This is what we are experts at. But addressing exposure to traumatic events that could cause toxic stress or asking about behavioral or emotional challenges are more challenging for a number of reasons. And I'll tell you what most pediatricians, and this isn't just Palm Beach County or Florida, it's nationwide, will tell you. The relative lack of time for us to perform adequate screening, the lack of training. As I mentioned, I noticed early on that I was unique. Poor compensation for the time needed and most definitely spent in adding that screening ability to our practice. And then that relative paucity of mental health professionals and the overall limited knowledge of referral sources in the area. So even if they're there, we've struggled with having pediatricians connected to the referral resources in the area. And we know there is a shortage of child psychiatrists. So, it's kind of our job to figure this out in spite of the challenges.
So how do you overcome those challenges that you just stated?
So what we've done in our practice and what we really have tried to educate other pediatricians in our county, especially. I, as you mentioned, I've been the president of our Pediatric Society in the county since 2013, and I really had as my mission in that role over these last however many years to really educate pediatricians and help them find ways to conquer these challenges that I know they would all tell me. And what we've done to try to set, an example and to say, well, we've done this, so, let's help you do the same. First of all, training our medical providers to diagnose and manage disorders, limiting the need to refer out. So incorporating the screening tools and then being able to actually do something with the results that we get and not needing to refer everything out to a child psychiatrist, which again, we know there are limited numbers of. We also have a model of dedicated care coordinators. So our care coordinators are paired with each one of our providers for that best communication and continuity of care of their patients who may have mental health needs. We know that this is a large time commitment to manage these patients. And having the care coordinators for us was where we finally were feeling like we were making a big difference. And that's been for now probably about 10 years that we've done that. And then allowing adequate time in the schedules to spend that time needed. And with that then comes teaching other pediatricians how to code properly. So coding for the insurance plans to pay us for what we're doing, billing for the work that we're doing, getting paid for the work that we're doing, fighting to get paid. And then hiring the mental health professionals for the therapy services. As I mentioned, we have a child psychologist and we have a psychiatric nurse practitioner. We're hoping to add a psychiatrist, a child psychiatrist soon. And so I really wanted, though, to share a story. If there are any pediatricians actually listening to this and thinking, oh, yeah, well, that just seems like it's just too much. So recently, as I mentioned, I've been in practice for 20 years. I've never used a screening tool for substance use. Just never really thought of it. I mean, we ask questions, but we never used a screening tool. So over the past year, perfect timing with the pandemic, we implemented a screening tool to for all 12 and older to answer about their potential risk exposure to alcohol and drugs. The information gained from this screening tool was so eye-opening for us. And again, as a practice that does a lot of mental health, we just never really were able to quantify the substance use quite as much as we could now with this screening tool. So then I found myself, as our other providers did, we were in these same positions that other pediatricians have mentioned to me for many years with mental health in general, struggling to know what do we do with the positive screens. We feel like there's a lack of resources to refer out. We don't have the time to address this. Are we going to get paid for spending the time? So what did we do? And again, this is what I encourage other pediatricians to do. We joined something called Project Echo. It was led by the Florida chapter of the American Academy of Pediatrics. And for the last 8 months, we've learned how to use a technique. It's called SBIRT, Screening, Brief Intervention, and Treatment Model for motivational interviewing to address the positives ourselves. We can do this now ourselves. We learned how to code appropriately for this technique, as well as the screening tools that we've known how to code for to hopefully be able to get paid for that extra time. And it does take extra time. And then we actively searched for a treatment program locally. And, I feel like we never really had much luck with this, but we found a treatment program locally that even takes most insurances. So just by now having this screening tool, it pushed us to have to look for this treatment program because now we were going to need them if our SBIRT technique didn't work. My own success story that I'm very proud of because it's the proof that you can teach an old dog new tricks. I'm an old dog and I learned a new trick. And I have a 19-year-old who I've taken care of since he was probably 2 when I first moved here. And he, on his screening tool, for a number of times that I had seen him, he has a history of ADHD. So I was caring for him over the years for that. And for this last year of using this screening tool, he had been, every time he filled it out, admitting to, there's a question about how many days or how many times you've used marijuana or other drugs. And he didn't even put a number. He just put a lot. Every single time he filled it out, a lot, all in caps, a lot. Like he was screaming this to me. And I finally was able to do something to help him. And I used this SBIRT technique. And again, I had never heard of this before December, and I learned how to do it, and I spent the time with him. And I'm so proud of him because the last time I saw him, he had been clean for over a month where he hadn't used any marijuana at all. And he went from using it multiple times a day to not at all. So, this is my point, is that as physicians, this is what we do. Continuing medical education, we have to stay current. We've all learned about COVID-19 and, how to manage COVID-19 in the last year. So mental health shouldn't be any different. Learning, the way to test for COVID-19. Well, how do we screen for mental health challenges and ACEs? Learning about the vaccine and how to give advice for the vaccine, the pros, the cons, same thing with mental health. We should be able to have these discussions with our patients. So screening, evaluating, treating mental health conditions should be no different and should be a top priority with us seeing so much more now during the pandemic.
So let's go up 50,000 feet, and you are teaching other medical professionals what you know, but is there really a shift in focus among your colleagues in pediatric care in general to provide more than just physical care? And how far do you think we are away from commonplace integrated models of care?
Well, we don't have a choice. We don't have a choice. Whether we feel properly equipped at diagnosing and managing mental health disorders or not, it's on our doorstep. We need to figure out how to manage this and help these kids, whether we have the time or not. It's not going away. There was a mental health crisis prior to the pandemic. The pandemic has just heightened it. And now the new thing we're seeing is the kids who have gone back to in-person brick and mortar, who would ever think we'd say brick and mortar school, are now the children that are less than 12 who cannot be vaccinated. Now they're developing anxiety about getting sick. What if they get COVID? They can't get a vaccine yet. So now, this is our conversation often, is they're having problem falling asleep at night because they're worried that someone's going to get them sick at school. And so this is our day to day. This is what we do every day. So, this is why we all have to learn as the community partners what our role is. And again, our role is that screening using these questionnaires. The American Academy of Pediatrics has even developed guidelines that we should all be using to help us screen, who might have issues. And typically it's at the well visits. So, all of you that have children, when you go to your well visit appointments, you probably have some of these questionnaires that you fill out, and it is coming from the American Academy of Pediatrics. So this just isn't our group. This should be all pediatricians. And those well visits should have ACEs, questionnaires, postpartum depression. Even when the baby is first born, the mom should be filling out that screening tool until the baby's 6 months old. Developmental delay, every visit, we're asking screening questions about development. Autism, we screen for at, different ages, anxiety, depression, ADHD, and as I mentioned, substance use. So that's even, an AAP guideline. So the first step is for us to, really identify those at risk to be able to refer them to the critical services. And then that next step is knowing the services. And, in Palm Beach County, we're fortunate to have Children's Services Council and our Birth to 22 programs that definitely help us navigate the referrals that are needed. But all counties don't have that. All areas of the country don't have that. So, an integrated model with pediatricians' offices or family practice or internal medicine, primary care offices with mental health is the direction that we need to now really get serious about and try to figure out how can we make this work. When we really, are able to follow these AAP guidelines, we are left with trying to manage the next best steps. And, nationally, there are other pediatricians who have figured this out and have made this work. It's just challenging because state by state, it can vary because of the insurance. The insurance is always the part of this discussion that gets tricky. So an example that we have used that really works, and we're very grateful for, is the Healthy Steps program, which is a nonprofit program where we have developmentalists who are in 2 of our offices who enroll newborns and follow them from birth until 3. Whenever they come in for a checkup, the developmentalist meets with them and does have the time to do infant mental health screening, developmental screening. They do the postpartum depression as well with the families, and then are even able to plug in the families that have the needs much more quickly into the system than we were capable of doing without them being in our office with us. So now we need something for over 3. And, communication amongst the families with the pediatricians and the mental health care team is so critical. And that's what we have struggled with, as well as, we've tried to integrate our own staff of therapists and the psychologist, as I mentioned, the psychiatric nurse practitioner, but we run into credentialing issues because we are a medical facility, which is a whole nother discussion probably for another day. But just so everyone knows, this is why it is a struggle. And we've worked for many years with different models of the integrated mental, physical health concept. And we continue to fine tune what has worked and maybe what has not worked so well. I have a wealth of experience now with this, and I do really finally see what may be best. And what that is, we are working now with Renee and the Center for Child Counseling to develop a pilot program that hopefully we can then teach, as I said, leading the fight now to educate more than I ever have before about how to integrate mental health into primary care. And the key, again, is that having the contact who is a warm handoff in spite of what the patient has as an insurance. So the insurance, again, has been the tricky part. So expanding the Healthy Steps model for us is what I see potentially, hopefully, being finally the answer. And that, again, will be for the 3 and over, and having that contact person in our offices, that whether they do the therapy themselves or whether they refer out to maybe the specialist for that particular type of therapy and need, we're working more together. And we, as the pediatricians, are able to be that medical home and direct the care as we should be with mental health, which again is just as important as the physical health.
Dr. Fox-Levine, I can't wait to see how this collaboration with the Center for Child Counseling goes, and thank you for providing that insight from your field. Next up, Amber Payne. Amber, how are you doing this morning?
Oh my gosh, doing great, blown away, happy to be here.
What a great discussion.
I agree.
And before we continue, Robert asked in the chat, shouldn't we be teaching this to all law students? And we should be teaching this to every industry, teachers, law students, policymakers, politicians, anybody. That's the whole purpose of this. And yes, they should be teaching it in law school. Amber, in 2019, yes. The Center for Child Counseling published the white paper, A Public Health Approach to Fighting ACEs in Palm Beach County, a collective plan to address childhood traumas underlying our spiraling rates of child and teen depression and suicide, school shootings, addictions, violence and abuse, and other social challenges. How are these made more acute by the COVID-19 pandemic?
Well, I mean, you've heard our panelists so far kind of talk about this, but it's obviously adding a huge increase in children needing mental health services. And we anticipate a second pandemic effect, obviously due to what Dr. Fox-Levine was talking about, due to that traumatic either isolation, and also Ed Tierney was talking about earlier too, that fear, the anxiety, the depression experienced through COVID-19. You know, we don't know the long-term impact, but we anticipate that second pandemic effect of that. And then, you know, we've seen obviously the CDC and the Children's Hospital Association produce some statistics about the increased need in the emergency departments. So there's been a 31% increase in youth aged 12 to 17 needing services through the emergency department, you know, mental health services. That was a 31% increase over 2019. That happened in 2020. We've seen ages 5 to 11 have a 24% increase, and ages like I was saying earlier, the older ages having that 31% increase. We've also heard from about 64% of teens believing the experience of COVID-19 is going to have a lasting impact on their generation's mental health. So that's their own, community voice. That's their own personal belief that it will have a lasting impact. And we know that 6 out of 10 of the youth are saying that their sources of support that they turn to normally are harder to access, which is that whole concept of that buffering relationship and, building that resiliency. So you we know it's having a very dramatic increase in needing mental health services.
Based on your recent work, will you unpack what we know, what we're doing, and what we still must do to build a long-term response to the pre and post-pandemic escalation of ACEs?
Sure. So in the white paper, we kind of list out the things that we know. We know the connections of how the brain is built. We know how prevention works, right? We know that directly supporting trauma-informed and responsive approaches across systems at all levels of prevention, right, that serve not only children, but their families and their caregivers and the community buffers in the, that might have contact with them. This can and will mitigate the negative impacts of the overwhelming stress and help children thrive now and beyond the pandemic. And we know that children, 1 in 5 will experience a mental health disorder at some point in their life. So we know this is something we need to pay attention to, and that the time is now. And this is an invitation to join the fight, and help lead the fight. So what we're doing, we're implementing best practice public health strategies. And that public health approach is population level. You're thinking of, whole communities, whole schools, you're thinking of whole service systems and sectors. You're thinking of everyone in the community playing a different role and having a responsibility, because this is an investment now. And we know that if we don't do anything, the long-term impact, not only on the individual, but on the community in every sector is felt. And so, we have to create the trauma-aware adults within our homes, schools, and community service centers. We work with children and adults individually on that prevention continuum to build their resiliency and capacity to buffer and mitigate trauma. So we work within core sectors and systems to cultivate that shift in mental models, how we think about it, how we see it. Once you see it, you can't unsee it. So we use, psychoeducation and role modeling with mental health consultation and universal education, skill building, and training. We talked about our way of being training available to everyone. It can be used alongside other interventions. And it really helps promote that mental model shift and helps to build that skill in any setting to interact with individuals who might be needing support at the continuum. So we provide targeted early intervention, small group play therapy, as well as individual treatment and dyadic therapy to help clients move through trauma. So what we still must do is continue this grassroots to grass tops public health, population health, trauma-informed way of being, right? So we have to improve access to prevention and early intervention co-located. So in the childcare centers, you saw that video at the beginning. In the schools, we've heard from the schools, in the pediatric centers, in the institutions of higher education. So getting that co-located, building that awareness, that mental model shift, because creating that lens is so important, and building that skill to intervene at the appropriate level based on your role is really important. We know that for pediatrics, 1 in 5 kids are going to experience a mental health disorder, and that largely they're in their pediatric homes, they're in their primary care settings, they're in school. So looking at that prevention model, right, and not waiting for kids to fall apart, not waiting for that mental health diagnosis, and having that early intervention, prenatal, birth to 5 is where the science is telling us our largest investment, high reward, low cost, is where we need to be. We need to continue to co-locate services. We need to continue to build our capacity within our sectors and our service systems, because these visible behaviors that we see are that manifestation of trauma. And so we know, and if you're trained, you can see it earlier and earlier and earlier. And you don't have to wait for, like we're talking about the school shootings and all these other, I'm substance using a lot. We can see this earlier.
So going back to the report, the public health approach to fighting ACEs in Palm Beach County that was published in 2019, and which is available for everybody at centerforchildcounseling.org/white paper. How can other communities model this report to institute their own public health approach to fighting ACEs, Amber?
Sure. So, we did a year-long kind of, intervention with the community in terms of how we were going to look at this and build the report. Obviously, Center for Child Counseling is integrated in the community and has been for a long time, either through training our community and future interns and therapists, and working obviously co-located and doing, in schools and childcare centers and teens and families. So what we did was we used a couple different models. We did a community readiness approach that determined where we're at as a community so that you could build a responsive strategy off of, and leverage what we had going for us in Palm Beach County. And we scored a 5. We were ready. We were aware. We had some resources. We had some funders who, on our first slide, you can see those funders who've been really champions of this in our county. And so, we knew that we had a groundswell. We had a good grassroots effort, Birth to 22. So there's a lot of movement in that. And we also had this Lead the Fight initiative of building this education and awareness. So we then were using a think tank. What did the community at all levels and all service sectors, pulling them together? What were the problems? What were the solutions? We plugged that into a FSG's water systems change, thinking of it from, inequities, that are holding the system in place, right? So thinking of a systems change model of what are some of these problems and what are some of these solutions. We got together high-level leadership, those grass top, leaders, and reviewed what were some quick wins and what were some major projects for each core sector. So we had that buy-in from the community and that ownership. What could you do? What was the what was the first thing you could do to own it and lead the fight? So we published all of that. We leveraged and utilized existing data to know, from an ACEs lens, what are the ACEs indicators in our county? What are we working towards? What are we trying to impact? And that all help build awareness, shift mental models. Really, CFCC is championing this alongside so many others in the community. And so that white paper really did galvanize that momentum and amplified the efforts around us.
And this model you're talking about of change called Building Trauma-Informed Communities. Can you show us what that looks like?
Sure. I have some slides. Okay, thank you. All right. So when I was working with Center for Child Counseling, we were funded to create a theory of change for the Fighting ACEs initiative and all of the programs on the prevention continuum. And what we have here is really neat, because what it's showing is not just this high level theory of change, it's breaking it, this high level, population level theory of change, to how it will look and feel from an individual perspective. So Ilio here. And really, this public health approach is showing you all the different sectors in the community as a child, as an individual, moves through the community as we all do, experiencing either individual ACEs, adverse childhood experiences, or maybe a community ACE, an adverse community experience, like we all have collectively with the pandemic, or like a school shooting or a hurricane or something like that. And what this shows you here in this graphic is what happens when we get it right, when we have buffers and trauma-trained individuals along the way as an individual goes through life and might experience things either personally or in their family or in their community or in their school with their caregiver. And so when you get it right, there's that chance to come in when you see it, right, and be the buffer and be that change. So this here is really about how you create trauma-aware adults within our homes, our schools, and our community service centers who recognize trauma and who have the skill and capacity to buffer and help support and build resilience and have that trauma-informed response like we've seen from the court system and from pediatrics. So that is that overall kind of visual broken down at that individual level of our theory of change that can help translate this message. And so I want to break it down kind of for the steps of you as an individual. So I'm going to go to the first step is really knowing the signs, right? So we saw how Ilio was having things that were happening, but you may not necessarily know that background of what's happening. So it's understanding how the risk factors and exposures to trauma can affect children for a lifetime, right? The understanding that unaddressed traumas can lead to negative behaviors with those lifelong consequences. Many of us on this panel, many of us joining in today might already know that, but it's knowing the age-appropriate display of those behaviors that really go along with trauma that are happening. And so some of our trainings and our way of being, it's been funded, and I think they've been putting it up in the chat to access it. I strongly encourage people. There's a manual that you can do on your own. There's the trainings that you can go along with it that can help you have that lens and have those eyes to see. So knowing the signs is very important, and knowing then what that behavior might look like as a response. It's not always aggression, right? It can be that withdrawn. It can be that anxiety. It can be, stomach pain without any kind of, necessarily related illness. So there's all of that knowing the sign step. The next step is really knowing your role. So it's that prevention, identification, and treatment, right? Who are you in relationship to the system? Who are you in relationship? What role do you have in terms of, that prevention, that early intervention, and that treatment? And so it's knowing how you plug in, right, to that prevention continuum, and knowing where you intersect within the community, in the sector, whether it's business or it's judicial or it's education or it's childcare center, understanding what you can do. And again, that best weapon is targeting children ages birth to 5 and children looking to adults, right? So children learn how to self-regulate within the context of adult relationships. And so having children looking to the adults to see how mitigate, move through trauma. And the next step is knowing the solution. So in some of our instances, we have throughout the community, education, doctors, nurses, faith leaders, police, and the courts, and it changes the game when they receive that trauma training.
Thank you, Amber. We appreciate that view from above. I'm going to ask Ed Tierney to join us one more time, our representative from the school district. Ed, you with us?
I'm here. We've been having internet issues the last 2 days, so I cut in and out a couple times, but I'm here.
Well, I'm glad you're with us. The Center for Child Counseling is in laying down its foundation for building early children's mental health, created a manual called A Way of Being with Children. We've discussed it a couple times today. There's also a classroom version of this for teachers. It's free to all schools and childcare centers. Why is it important that every school and teacher use this curriculum?
Yeah, I really like the curriculum, what I've seen of it, because it focuses on building resiliency, which has been a theme throughout this conversation, and also on communication, which is really the bedrock of human relations and relationships. So the focus there, I think, is really strong, and it works on adult skills around relationships, being positive, listening, praising, encouraging. So we think this is just kind of a universal skills that the more adults are able to develop those skills within themselves, the more we'll be able to help students.
Thank you, Ed. I'm going to now open up some questions to all the panelists. So if you have something to say, feel free to jump in. And if our audience members want us to address any final points, this is the time to put it in the chat. So to my panelists, considering the COVID-19's pandemic's additional long-term effects on children, which actions do you think we should prioritize to make the greatest difference now and in the future? Anyone want to take that first?
I'll say just a few things. So, what we saw in our office over the past year with virtual school, we realized that the routine of the day is probably what contributed, or lack thereof, routine of the day is what contributed to the mental health issues we were having. These kids rolled over in their bed at 7:30, turned on their computer and laid there in bed in their pajamas and, tried to learn. And when you think about what you have to do on a day-to-day basis to actually get yourself to the office, right? Like you have to get up and take a shower and eat your breakfast and brush your teeth. And it's all of this like getting ready to get to where you need to be mentally to start your day. And that's what these kids were lacking. And my hope is that now that they are back physically in school, we start to see less of that having been an issue for kids that had never shown any signs of anxiety or depression. Those were the ones that seemed to be the most affected even by this lack of routine, because they were the ones that did tend to stay home for the whole year for virtual school. So I think it's great that our kids are back in school. Now the trick is to keep them healthy, to keep them back in school. So as a pediatrician, this is what we do. We need to keep our kids healthy and, vaccinate them, have them wear masks, just keep them as healthy as we can because we want them to stay in school. This is absolutely the place they need to be to learn and to be able to develop their relationships, socialize. This is where they are happiest, whether they say they like school or not. We saw this firsthand. They need school. They need school to have healthy minds. And again, it really, I think, comes down to having that routine every day and getting those endorphins and stress hormones ready to go for the big show when they get to school and they can put their mind into what they're doing, and also being held accountable because they're sitting right in front of their teachers. So important to keep our kids healthy during this pandemic so that we can keep them in school.
So let me throw another question at our panel. Beyond individual trauma, we must recognize the community and historical traumas that arise from discriminatory systems and policies, institutional racism and oppression. How is equity being addressed in the work you do? Anybody want to take that? Memi, Dr. Graham?
Yes. In our work with the courts, we know that child welfare is overly representative of people of color and children of color. And there's a lot of efforts to instead of removing the kids, to have conferences with a team and without knowing the racial makeup of the family so that we can cut out that discrimination from the beginning. We also know that there's not enough clinicians to begin with, and there certainly are not enough clinicians of color. So our Florida Association of Infant Mental Health has a support group for Black mental health clinicians that is providing reflective supervision and support for them. And we are training child parent psychotherapists. We have recruited people of color, and we need more men in our work. And there are a lot of underserved areas. So we geo-mapped where we have our highest number of kids and tried to recruit from those areas. We have a long way to go in order to achieve any kind of equity and to really have the number of clinicians that we need to serve our families that look like them. So we need to do a lot.
Thank you, Dr. Graham. One question, I'm going to make you all answer this question. I'm going to give you 90 seconds to do it. From our discussion today, what is your most dire call to action for this audience? What can we all do to move this work forward? And I will start with Amber Payne. Mute. Don't you love that on Zoom?
Sorry, can you hear me?
Mm-hmm.
To move this work forward, I think, what I would like everyone to do is to check out our Way of Being training. I truly believe that individuals, clinicians, and grass top leaders, everyone could benefit at some level. We all come in contact with either parents who are in the trenches, teachers, caregivers. So that's my response, is check that out. And there's, that's a universal strategy. No matter what your risk level is, there's something you can take away from it to have an impact and create change.
Thank you, Amber. Ed, do you have anything to add?
I think that's well said. My own personal opinion is I think that I'd like to see adults always kind of scanning for students who are struggling. It was said before, sometimes you notice through a behavior, but oftentimes it's just a student withdrawing and kind of cocooning. So, Boca Raton High School a couple of years ago, the students developed this program called We Dine Together, which is, if a kid was sitting by themselves eating, then other kids would come and join them or invite the student over. I think it was the captain of the football team who actually started it, who had a lot of social capital. And I thought, boy, that's really, kind of a special program and a lot of insight for students just to make sure that they were, interconnecting and watching out for each other.
Great idea. Dr. Graham, any final thoughts?
Yes, I think we all need to continue to be champions within our own neighborhoods and communities and systems, and to talk about trauma and to help others see that mental health is not a stigma that we all care about, and just reaching out and as the superintendent said, noticing those kids. We know suicide rates have really skyrocketed, and to be reaching out to everybody in our world, are you okay? Dr. Folletti, who created the ACE study, said the simple act of asking and listening and accepting can be therapeutic in itself.
Dr. Fox-Levine, you're up.
As I mentioned, our kind of motto in training, see one, do one, teach one. As community partners, the more of us who can try to reach out to those in our same, our colleagues who are unfamiliar with ACEs and, are interested in being trauma informed, we all need to be doing that, because there are too many people to touch for just a few of us to do that. And again, I think primary care doctors, but all medical doctors should be trained with the trauma-informed concept. And so that's, as I said, my commitment and my practice's commitment is to be able to start sharing our knowledge for the integrated care model as we work with the Center for Child Counseling with that.
Dr. Graham, we got one more question for you. It's an interesting one. Someone is interested to hear about the study of the differences between children in Little Haiti and Liberty City. Do you have any more you can add to that comment?
My colleague, Dr. Rebecca Shearer from the University of Miami, is doing that research. And if you'll put your email in the chat or your number, I'll be happy to connect you with her. She's doing incredibly interesting research. So we're trying to figure out, are they family resilience things? Is it the combination of the families or the neighborhood or the supports? What is it that is really creating the resiliency and the ability to bounce back gracefully in those communities? But I'll be happy to connect you.
And thank you, Samuel, for that comment. Dr. Graham, look out for a chat comment from Samuel. He's the one that asked that question.
Okay.
Thank you, panelists, for your intelligent, insightful, and informative views today. By following your steps, we can all fight ACEs head on. We end every Lead the Fight event with a rally cry. Here is the call to act and what you can do. Get trained. Be ACEs aware and informed. Sign your place of employment or organization up for an inexpensive training that will change your view of our community forever. Invest in ACEs economics. Our business leaders must get behind early childhood development to grow a thriving economy and brilliant minds to lead it. Push the agenda. Form on ACEs action committee in your community to raise awareness and activism. Fund the work in your community. Donate to causes fighting ACEs to further their training, resources, and services. And as our last announcement, I'm really thrilled to say that next year we are going to be producing Lead the Fight 2022, which we hope will be an in-person 2-day conference that includes workshops, panels, keynotes, and trainings. We look forward to sending you the dates and the location soon. Center for Child Counseling is really taking this to the next level. If you're interested in viewing this program again, just like we did part 1, we posted it to our YouTube channel, and I'm sure someone will put that link in our comments, or just Google YouTube search Center for Child Counseling and you'll find us. We cannot thank you enough for your participation today and your time and your commitment to this fight. Thank you.
Thank you so much.
Thank you.
Thank you.